According to a Gallup poll, Americans would delay getting medical care in 2022 because of the cost. The sad reality of a culture that is solely materialistic and devoid of empathy is that more than one-third of American medical treatment was delayed. The number of Americans who reported delaying medical care in 2022 because of cost increased 12 points in a single year, reaching 38%, the highest rate in Gallup's 22-year trend. Since 2001, Gallup has kept track of Americans' self-reports of deferring medical care due to expense in the previous 12 months. The most recent reading is the highest by 5 points and represents the biggest year-over-year increase in Gallup's annual health and healthcare poll, conducted from November 9 to December 2. Due to this development and the highest United States inflation rate in more than 40 years, 2022 was a difficult year for many Americans. Most Americans claim that inflation makes their lives at least somewhat difficult. The public continues to have an unfavorable opinion of the state of the American economy, and more people than ever before named inflation as the country's biggest concern for 2022. After two consecutive 26% values during the COVID-19 pandemic, which were the lowest since 2004, there was a recent double-digit surge in patients postponing medical care. Before this, the trend peaked at 33% in 2014 and 2019. Between 2001 and 2021, 29% of Americans reported delaying medical care due to cost. Americans were more than twice as likely to report the delayed treatment in their family was for a serious rather than a non-serious condition in 2022. In all, 27% said the treatment was for a very or somewhat serious condition or illness, while 11% said it was not very or not at all serious. Since 2004, more Americans have indicated that they needed medical care for a serious ailment than for a less serious one. Still, the 16-point difference in perceived seriousness of skipping treatment in 2022 is the second largest on record, after only a 17-point margin in 2019. Delaying the treatment of a significant medical illness would have additional adverse effects. In other words, 27% of people were compelled by cost to choose death and misery. In the United States, persons with lower incomes, those who are younger, and women have regularly reported having delayed seeking treatment for a significant medical problem. Americans with yearly household incomes under $40,000 were almost twice as likely as those with incomes of $100,000 or more to report that a member of their family had put off seeking medical attention for a serious condition in 2022, 34% versus 18%. Regarding delaying care, people with an income between $40,000 and under $100,000 behave similarly to those in the lowest income category, 29% delay care. Reports of delaying treatment for a critical ailment increased by 12 points among lower-income American adults, 11 points among middle-class Americans, and 7 points among high-income Americans. For the middle and upper-income groups, the most recent readings are either the highest ever recorded or tied for the highest. In 2022, there were also apparent differences in the age groups reporting postponements of care, with younger and middle-aged persons significantly more likely than older adults to indicate that they or a family member postponed receiving medical attention for a critical condition. The fact that Medicare covers Americans 65 and older accounts for this. 35% of persons between the ages of 18 and 49 reported delaying care for themselves or a family member, a new high. 25% of adults between the ages of 50 and 64 and 13% of adults over 65 also reported doing so. The readings are higher by 12 points for individuals under 50, 10 points for those between 50 and 64, and 6 points for those 65 and beyond. Regarding gender disparities, in 2022, 32% of women and 20% of men reported delaying medical care, which is a 12-point rise for women and a 5-point increase for men from 2021. The resulting gender disparity of 12 points is significantly higher than the 7-point average gender gap since 2001.